All right, my friends, welcome back to the Hotspot. Now, of course, last night we reported the unbelievably tragic news of our island's 386th COVID-related fatality, which was a 6-month-old baby boy. Now, here to talk about the importance of vaccines for young Guamanians, for children, who better than Dr. Bob Leon Guerrero? He is, of course, the interim chief medical officer over at the Department of Public Health. Doc, welcome to the show, and it's so good to have you here, because I can think of nobody better that when we deal with this topic and we really want to get the information out to let every single Guamanian know that the vaccines are available for kids. You're the perfect person to champion that cause. So thank you for joining me today.
Thank you for that. But you forgot to add that I'm also a pediatrician at Department of Public Health. So yeah, yep. I deal with a lot with kids.
Okay, since the news was first distributed, Doctor, are we seeing like a great deal of foot traffic for people bringing in, children over the age of 6? And are we seeing like the number of youngsters getting vaccinated skew a little bit more on the younger side?
Since the news of the death? No, because the death just occurred yesterday, I think.
Oh, no, I mean, since the news of that young children could be vaccinated, because I know it came out a few days ago.
No, actually it came out about a month ago.
Okay.
And the amount of people taking advantage of that was, it was like, of all the kids that were 6 months to 4 years, maybe about 0.01% got vaccinated. It's been in the last week, I think, is that when we started seeing more people bringing in their 6-month-olds. And part of that's due to the messaging. I don't know if you know who Dr. and Dr. Del Rosario. They have a 7-month-old, at the time, 7-month-old child, and
Sure.
He got his first vaccine. And in fact, on Saturday when we had the vaccination clinic for the young kids, they brought in their child again to get the second dose. So they put out a PSA, and I think we see more foot traffic in this past week. I'd like to see more. I like the way Dr. David put it, because I like Star Trek. She says, when the shields are up, it defends the ship much better. And shields include masking, social distancing, washing hands, vaccinations and testing and treatment for if you do have it. But if you're lacking in one, then your shields don't work as well. And we do have a problem with COVID. COVID's here to stay. It just likes us too much. And it finds ways of getting around the antibodies that are produced when we get infected or get vaccinated. It used to be that 3 months, you're pretty much safe that you're not going to get sick again if you got COVID. Now it's more like 4 weeks with the new variants.
Mm-hmm. Now, Doc, is there any difference? I know, with the mechanics of how the vaccines, the time between vaccines, because like you said, it's I know for the Pfizer and the Moderna vaccines are both available for children 6 months old and older. But I know for fully grown adults like us, you would get one shot and then you would wait 3 weeks and get like another shot. The range between when you get shot 1 and shot 2 is a little bit different for little kids, right?
Well, okay, so the 6-month-old to 4-year-olds, if you get the Moderna, it's basically the same, okay. And it's 4 apart. The Pfizer, on the other hand, what they did was they lowered the dosage, so less problems with side effects. So theirs is a 3-shot primary series. So they get one, 3 weeks later get another, and 2 weeks later get their third dose. So it's the primary series for them is 3 shots. It's not, so the third shot's not a booster. It's just part of the primary series was for the Pfizer.
Mm-hmm. And approximately how many young children, now, given that the fact that the age range has now been so dramatically reduced again, so 6 months and older, how many Guamanians does that approximately cover?
I think I don't remember the exact numbers, but I think it's around somewhere between 6,000 and 10,000.
Mm-hmm. So that is very, very significant, especially given the fact that that kids across different ages are now back in school.
Yeah, correct.
Okay. What are the most typical questions, Dr. Bob, that tend to bubble up when either when people contact you or contact your colleagues and they say, you know, I've got a young child, I believe in the vaccine, I want to get them vaccinated. What are the most common questions so that hopefully we can address them here and, you know, just like allay any concerns that parents may have?
Well, first of all, the most common question I get is, you mean we have a shot for that age? Because a lot of people don't really know that the shot's available for kids 6 months and above. So after we get through saying, yes, there is a shots, and yes, and I basically tell them, they're worried about side effects. And I tell, these guys get numerous shots in the first year of life. And we always tell them there's going to be side effects. Most of them are mild, pain, obviously, swelling where the shot site is given, and crankiness and fever later on the night before. But for kids, they tend to tolerate the vaccine fairly well. I haven't heard too many serious complications or any bad complications with the vaccine for kids 6 months. Granted, the amount of kids that are getting it is low. So, but yeah, they seem to tolerate it fairly well.
So, and when kids come in themselves, is it more the kids are hesitant, or is it more like what their parents are just kind of concerned about? What might this do to my child? Like, because from what I've been hearing, too, kids are tough.
Yeah, and any shots for that matter, kids are afraid of. Okay, because they don't like who likes pain. So they're hesitant about it, but that's with all the shots that are available. It's the parents, they think, and one of the other thing that they ask is, well, do kids get serious complications with the COVID? And I go, you're absolutely right. Most kids don't have a problem with COVID. They either have mild or no symptoms at all. The problem is that then, most of these houses on Guam are multi-generational. You have the kids, the parents, grandparents, and sometimes even the great-grandparents. And, grandma and granddad are not going to say, stay away from me to the child because you might have asymptomatic COVID. I mean, these guys smother their grands, and that's just typical of life around here. They show a lot of love to their grands. And so if they have COVID, it's easy for them to spread. And that's the one thing I really push, because until recently, the youngest person to die from COVID was the 10-year-old.
Right.
The 6-month-old was, and I'm not too sure yet what's the outcome. All I know is that this kid presented to the emergency room with no pulse and no breathing. And they worked on this child for, I think, a good 2 to 3 hours. And then they, while they're doing this, every person coming to the ER, they swab. And that's when they found out the child was COVID positive, only after they started the CPR and stuff. So obviously that child's going to probably get a autopsy done to see if in fact it was due to viral disease or maybe something else. But we do also have a kid that was in the Peds ICU in the past 3 days, who was only 3 weeks old. That only symptom that child had was turning blue. And you can imagine a parent seeing their child turn blue, not breathing.
Right.
I think this child had about 6 or 7 episodes. The first 4 were outside the hospital, and the next 3 were while inside the hospital, and including the Peds ICU. So that one, the only thing that was positive was the COVID testing. Everything else, didn't have a seizure disorder. The EEG was negative. The CT, the head ultrasound were all negative. So the only thing we could contribute this to is COVID, because young kids sometimes have what they call central hypoventilation syndrome of any typical virus, not just COVID, but any virus where they just don't breathe. Their brain somehow forgets that they need to breathe to survive. And so they turn blue until you stimulate them. So whether that happened to that 6-month-old, I don't know. But, when I first heard about it, I was taken aback by it because, like I said, the previous one was a 10-year-old who had multiple medical problems.
Right.
I don't know the medical history on this 6-month-old. I don't know if he's up to date with shots. I don't know if he was seen at clinics. All I know is that he presented to the ER pulseless and breathless.
I remember Dr. Bob, like, I believe it was maybe several months when the pandemic really first started here on Guam, when I believe it was a 13-year-old who passed away from COVID. Then it was, it was a 10-year-old several months later, and now a 6-month-old baby. Is unbelievably tragic. And since you brought it up, we were reporting earlier that as of last night's Joint Information Center report, there are 2 Guamanians that were admitted that are pediatric cases. So again, to the family, we at KUM would like to extend our deepest sympathies and our prayers to the family of the 6-month-old that was reported that had passed away from COVID yesterday. Doc, I did want to ask you something for parents that do, and parents and guardians, I might say, that make the choice to get their youngsters vaccinated. Is there anything as far as deciding between either Moderna or Pfizer, or say like the parents have both received Moderna, and their symptoms were either mild to none? If they have had a fairly mild response to that, should they opt for the vaccine that they received for their child? Like, is there anything like as far as relatives being a little bit more handling the vaccine better, or should they basically just like choose whatever feels better?
I mean, if you feel comfortable with the Moderna, or you feel comfortable with the Pfizer, obviously that I would recommend getting the ones that make you more comfortable. I would tell them that with the Pfizer for the 6-month and 4-year-olds, it's a 3-shot series, and with the Moderna, it's a 2-shot series. And the reason being is that it's a little bit more medication in the Moderna, so there might be a slight higher risk of side effects, but it's so minimal. It's whatever you feel comfortable with.
And so hopefully, perhaps if youngsters should receive the vaccine, like maybe on cases where their arm's a little bit more sore, they experience a very, very temporary fever, they might miss maybe a day of school. But I know that's a concern, but we've been saying, for the last 2 years and everything, I guess, the perfect attendance ambition is pretty much like right out the window right now. And it is going to be for the foreseeable future, because like you said, COVID is here to stay.
Yeah. I mean, from what I heard from parents when they talk to me, most of them say that they're fine. They don't even have to miss school if they attend school. Dr. Alma and Dr. Del Rosario actually did a YouTube video showing him and how he reacted for the next half hour, and they said it was fine, no problems. He did the first shot, he didn't even cry. So yeah.
And I really would encourage everybody, please go out, and the video that Dr. Bob is referring to, of course, with Dr. Michael and Dr. Amanda Del Rosario, their infant receiving the shot. It's on the governor's Facebook page, facebook.com/govluguam. And if you watch it, I mean, these are 2 board certified pediatricians themselves, but they're also a new mom and dad. So, I mean, they're experiencing the exact same concerns and maybe anxiety that you did, but I mean, they also believe in the vaccine. So Dr. Bob, I'd like to give you maybe like one final push to all Guamanians watching this right now, near and far, about why it is so imperative that now that the age has been lowered for kids to get the vaccine, why it's so critical that they do so.
So they may not get as many serious complications, but it can occur. Like I said, we had that 6-month-old and then the 3-week-old. And last year we had some preteens come in with the multi-inflammatory syndrome. And if they didn't have the right medications, those 3 may have also expired. The first one, which we never saw before, we were lucky we had some of the medications available that otherwise that person may not have survived. And if you talk to the parents of those 3 kids, they were on pins and needles wearing for at least about 3 or 4 days. So it does occur, but it's rare. The other main thing is please get your kids vaccinated so they don't spread it. They don't miss as much school. And, school is very, very important, as we realized after the initial first year of COVID, where kids were doing online, and it was not as good as being there with your teacher and your classmates. So yes, please get the shots. You can get for those 6 months and 4-year-olds, you can get it at Public Health in Dededo, Monday to Friday, 9 to 4, Monday to Thursday, not on Friday, but then Saturday, 9 to 11. And then you can get it also down in South by appointment. So yeah, and then the older kids probably can get it at their clinics that they normally are seen at.
Right. Well, of course, that's Dr. Bob Leon Guerrero, the interim chief medical officer over there at the Department of Public Health. No one knows better than Dr. Bob about why the vaccine for young people are so important. Doc, before I let you go, I want to say you are the Guam physician who, with all respect to all of your colleagues, fellow physicians, pharmacists, nurses, you've probably be the medical professional with the best virtual background. I've been meaning to ask you this for the last 2 years. Where exactly is that virtual background, Doc? Where is that?
Outside my house.
Okay, that works.
Yeah. So off to the to my right, excuse me, my left is Alupan Island.
Oh, okay, right over there near like what they also call like Sleepy Lagoon.
Yes, sir.
Okay,
Yeah.
very nice part of the island. So, Doc, thank you for sharing the sunset with us, or the sunrise, but more importantly, thank you for sharing the information and the encouragement and the peace of mind with us and everybody watching right now about why it's important that we vaccinate our young ones. Thank you, Doc. We appreciate it.
You're welcome. And again, please, for those that haven't heard the message, because I keep repeating it over and over again, wash your hands, social distance, wear a mask. The mask mandate is gone, but that doesn't necessarily mean not to wear a mask. This is just, we don't want to force people so much as try to have them use their brains to realize that it's important to that. Get vaccinated if you can, and if you got vaccinated, get boosted if you can. And if you're sick, see your doc so that they can check and see if this is in fact COVID. And especially for those in the 50 and over, they can get the monoclonal antibodies or the antiviral pills. So please just follow those.
Our doctor's orders, and thank you for the info and the encouragement once again. Can do, will, Doc. We appreciate it, and we'll talk to you very soon.
Adios.
All right, please stay tuned because the hotspot will wrap up when we return right after this.